Okay, happy Thursday, everybody. My name is Nina Ignazik, and I am the founder and editor of Planet Detroit. And we are so happy today to be able to share this important conversation with you about PFAS, our forever chemicals. I have a really great panel with me today, and I'm going to let them introduce themselves. These are all folks that have worked on this issue in Michigan for quite a while, and we're going to dive pretty deep into what's happening with PFAS in our community. If you are watching this on social media, you can post questions in chat and we will see them. So we will have a question and answer session towards the end, and please do share your questions as we go along. So without further ado, I'm going to ask Erica Bloom to introduce herself.
Hi, thanks, Dina. My name is Erica Bloom. I'm the Toxics Campaign Director for the Ecology Center and help lead the Great Lakes PFAS Action Network.
Okay, thank you. And Elin.
Hello, my name is Elin Betanzo, and I'm a water quality engineer with Safe Water Engineering that's based in Detroit, and I help water utilities comply with the Safe Drinking Water Act.
Okay, and then last but not least, Tony Spagnola. You're muted, Tony.
You would think by now we know better.
You would, but we don't.
Hi, I'm Tony Spaniola. I am an attorney here in Metro Detroit. My family, though, also owns a home in northern Michigan in the community of Oscoda, which was the first PFAS site in Michigan all the way back in 2010. And my home in Oscoda has been impacted by PFAS. And as a result of that, I and some others formed a community action group in Oscoda called Need Our Water. And then from that, we helped to form the Great Lakes PFAS Action Network, of which I'm the co-chair. And it's great to be here. Thank you.
Thanks so much to all of you. All right, so next slide. So this is what we're talking about when we talk about PFAS. They're called para and polyfluoroalkyl substances. They are chemicals that are used in a wide variety of consumer products. Next slide. And they are found, unfortunately, everywhere in our environment and in our bodies. So this map is a map as part of some of the reporting we did earlier this year on PFAS. And this is state data just showing areas where, in the purple, where PFAS has been detected in sampling of groundwater. And some of the red dots you see there are actually sites known to be highly contaminated with PFAS. So I think one of the reasons we at Planet Detroit wanted to do a series on PFAS was we think that there might be a misconception that PFAS is not something that we deal with in Metro Detroit, that it's just something relegated to up north and places like Escoda, where Tony was mentioning his family's been impacted. But we certainly do have PFAS everywhere in the environment, including in Metro Detroit. And these are some of the consumer products that they're found in, everything from firefighting foam to nonstick pans to clothing that is water repellent. And so they're really ubiquitous, and we'll be getting into a little bit more detail on what that means. Next slide. So we know that there's quite a growing body of research out there about the different health effects that PFAS can have. There's certainly uncertainty about how much and how much exposure will lead to these things, but things like certain types of cancers, developmental delays, thyroid issues, infertility, and low birth weight have been linked to a PFAS exposure. So next slide. So Tony, we're going to start a little bit with you and tell us a little bit about how PFAS is impacting Metro Detroit and your story in working as part of this Great Lakes PFAS Action Network.
Thank you. Yeah. So as I mentioned, my personal story begins in Oscoda, where my family received a letter in the fall of 2016 saying, You can't drink your water from your residential well due to potential PFAS contamination from the former Wurtsmith Air Force Base. And the contamination source there is firefighting foam that was used in firefighting training exercises on the base for a long, long time. In the course of our work in Oscoda, we've come to learn that there are actually multiple exposure pathways, drinking water being the primary one, but also fish is a major one. We're the first place in the United States to have a do not eat the fish advisory. That there are now others here in Michigan where that's happened, but other exposure pathways, including venison, small game, and other wildlife, and surface water and shoreline foam, which we find everywhere across the Great Lakes. And when our community was out there and trying to tackle this issue, we began to understand that PFAS is in fact everywhere. And so we decided to form a network. We reached out first to our friends over in the Grand Rapids area, dealing with contamination there from the Wolverine Worldwide facility. And we decided to form, to partner with NGOs like the Ecology Center, the National Wildlife Federation, and the Michigan League of Conservation Voters, and to give a voice to communities and individual impacted citizens all across Michigan and all across the Great Lakes region. And one of the things that we found has been that community voices often are too often stifled in this discussion. Lots of experts come rolling in. Lots of government officials come rolling in, and the voice of the community sometimes is kind of left in the background. So we aim to try to help people with PFAS contamination issues and exposure issues to have a voice and to have a seat at the table in the discussion moving forward.
Got it. And so what are some of the priorities that you're working on most recently within the network?
Yeah, so I think one of the really big, a couple, three really big things that come to mind from a broad kind of policy perspective is one, turning off the tap on the exposures and the contamination that we face all around us. There are 11,000 suspected PFAS sites in Michigan alone. And if we just continue to allow these chemicals to spew into our environment, we're never going to get to the bottom of this problem, and we're never going to solve it. So that's kind of one big point. Another one is to work with people in impacted communities to bring a meaningful cleanup to those areas, and then also to focus on the health impacts and to focus on to helping people with health impacts to address those problems. We have a legislative agenda, which I don't want to get too far into the weeds on about, but I think that the whole notion is, again, prevention, right? Cleanup, and then helping people with health impacts from PFAS contamination. And I just want to say one more thing. Yes, there's PFAS contamination, there's PFAS exposures all across Metro Detroit. One area that really concerns me is the former Selfridge Air Force Base. Since I know what's happened at the Air Force Base in Oscoda, and I know that Selfridge is right on Lake St. Clair, that really concerns me a lot. I don't think it's received the attention that it deserves. And I want to thank you, Nina, for the work that you've done to help bring this to light, not just at Selfridge, but these other areas of impacts across Metro Detroit.
Yeah, absolutely. That's what we try to do. So thank you for sharing your personal experience on this. And as we know, there have been regulations. There has been some movement, particularly around drinking water and fish, and then increasingly more recently around consumer products. So I wanted to dive into a little bit talking about just those two things: drinking water, which is also the water that we bathe in and we cook with, and then later on with fish. So I'll start with Elin Batanzo to talk about drinking water. Elin, can you tell us a little bit about what are the regulations that we have now with respect to drinking water? And I know that Michigan likes to tout us as being a leader in this area, but what does that actually look like?
Yes. So I think we have a slide here that has our drinking water requirements on it. And so I see it
It's going away. It's coming back. There it is.
Okay. So Michigan was one of the first states to regulate PFAS contaminants in its drinking water. And so we have limits that are set at our regulated public water systems. So these are community water systems and non-transient, non-community water systems. And so you see in the column on the far right are current requirements in Michigan. And so these are what we call maximum contaminant levels. So that's an enforceable level. The water systems can't have the levels of these contaminants higher than this. They need to meet this as a running annual average of quarterly samples. So in Michigan, we have MCLs set for PFOA, PFAS, PFNA. You can read down the list yourself. These are all in parts per trillion. The EPA has finalized a PFAS regulation where they also set MCLs, maximum contaminant levels, for different contaminants. Those will become effective in 2029. And you can see from the chart here that there's some differences between the federal levels and the state levels. EPA also always sets maximum contaminant level goals for each of the contaminants that it regulates. And the definition of a maximum contaminant level goal is the level at which it's safe, exposure is safe. So you'll notice that there's zeros in there for PFOA and PFOS. And that's the level EPA considers safe, but it's not enforceable. When we're looking for what a water utility is required to comply with, it's that MCL. And then the final thing I want to mention on this is that EPA is bringing in a new concept called a hazard index, where if a water utility measures more than one of the regulated contaminants, then they can also be triggered into additional requirements to treat for those. So we're not only looking at individual contaminants, but starting to look at mixtures.
Got it. And so I just wanted to mention some of the news I've been seeing lately, and we'll be talking about it in our Planet Detroit newsletter this week, is there's some resistance to these new federal regulations, which is most likely expected, but there are some lawsuits and water utilities are trying to challenge this requirement. So just kind of knowing about that. Does anybody want to comment on that?
Yeah, I do. I do, because I want to say that I'm really disappointed in the water utilities, to be very blunt about it. Water utilities, that's us. And the fact that water utilities are opposing health-based regulations, to me, shows that I mean, I understand that there are economic issues, but we're the ratepayers, we're the people who drink the water, and the fact that they are trying to fight those is very, very, very disappointing to me. And I want to say this also. I was in Washington, D.C., and I was involved in the announcement of those federal standards. There was a lot of work. I met with the scientists who worked at EPA on these for years and years and years and years. Very careful work went into these. And yes, they are based on science. There was a challenge to the Michigan MCLs, and the science was upheld for those by the Court of Appeals. There's a procedural issue that's pending before the Michigan Supreme Court. But boy, oh boy, I mean, kids, children, pregnant women, women of childbearing age, people with immune deficiencies and immunosusceptibility. This is a serious issue for them and for all of us. And to see industry, to see water utilities taking these positions, to me, is very, very disappointing.
Got it. Yep. Okay. So on to the next slide. In our reporting, we looked at all of the publicly available data for PFAS in water. And actually, this slide is a little bit of a misnomer because it's not just Detroit water, but within kind of the Detroit region, within the GLEWA system. And we did find PFAS detections in some of the distribution systems. Despite the fact that there's been a lot of talk from GLEWA that that there is no PFAS in GLEWA's water after it leaves the plant. However, once it gets to some of these communities, somehow some PFAS has been detected. So I wanted to have Elin explain to us, what that means and what we're looking at in terms of some of these local water systems that have PFAS detections.
Yeah. So just first, I believe this table is sampling conducted at the PFAS results at community water systems and non-transient, non-community water systems that have their own source. I don't think any of the ones that appear on the screen, I suppose Wyandotte might be on the GLEWA system, I'm not sure. But
Yeah,
I know
so.
you can find the full table for this in the Planet Detroit article on PFAS, and there's more to the complete table, but these are detections at water systems where the contaminants were detected, where we have an MCL. You'll see the dates in this table are earlier. We've got a lot of 2019 to 2021. So for Michigan water utilities complying with the new requirements, they were required to do their first round of sampling by February of 2021. And then they had, going forward, needed to comply with the MCLs. So in this case, I'm not sure if any of these particular ones, while they have detections, they don't have an MCL violation. Part of the reason this kind of ramp up period is to give them an opportunity to install treatment. So we reduce exposure so we have less in the water system. Now, Nina, you were just asking about some systems that are in the GLEWA system. GLEWA doesn't measure the PFAS contaminants in their sources, but there have been samples within some of their consecutive systems that have measured PFAS. We don't know exactly why that's happened. These sampling plans are kind of not designed kind of contiguously. Everybody is sampling at different times, so we can't really correlate what happens in one place on one day with samples in another location 6 months later. So there's some opportunities to explore that further to see what's really happening and how and how often those PFAS contaminants are present in the GLEWA system, since they were detected in some of the communities that buy their water from GLEWA.
Right, and I wanted to back up and make sure everybody understood what GLEWA stands for, because we do tend to throw around some of these acronyms. That's the Great Lakes Water Authority, and we did invite the Great Lakes Water Authority to attend this session, and they were unable to send somebody. So, and I also wanted to make it clear that, Elin, you're right. There are no violations of the existing Michigan maximum contaminant levels in these data, but we were able to find detections and some that would exceed potentially the future federal levels. So there is cause for concern there. Elin, how do water systems communicate this information with the public? What are they required to do, and how do they do it?
Okay, so every year, so water systems are required to sample annually. If they have regular detections, they get triggered into quarterly sampling. So we've got kind of a mix of systems that are doing quarterly sampling, some are doing annual. They are all required to report their results in the annual consumer confidence report, also known as a water quality report. So these were all water systems across the state had to publish and distribute these by July 1st. So if you live in a community that with a community water system, which is most of Metro Detroit, you should be able to look at your water quality report and see their PFAS sampling results. So water systems are required to report any detection of any of the 7 regulated PFAS. So if they're not detected in the system, you won't see it show up in that report. And then we have a few requirements for notification. So if there is an MCL violation, if a water system does exceed one of those maximum contaminant levels, we call that a Tier 2 public notice, and the water system has to notify people within 30 days. But I want to remind you that the MCL is based on a quarterly running annual average. So it's possible that there could be some reasonably high PFAS results for a whole year before it triggers that violation and that public notice. And then there's one other type of public notice associated with this, and it is what we call a monitoring and reporting violation. If a water system fails to monitor at all, they don't meet their requirement at all, then the water system has to do what we call a Tier 3 public notice, and they have 12 months. So if a water system says, hey, I'm not sampling, or they forget, or something happens and they miss a sample, they have up to 12 months to tell the public that they didn't collect that sample.
Got it. And so, um, folks should know, like, if you live in, say, Huntington Woods, you can look on your city website and find that information there.
Mhm.
Right. Okay. All right. Before I move on, anything else you want to add, Elin?
And so just kind of how things are going to go when the federal requirements trigger,
Yeah.
the federal requirements trigger reporting and consumer confidence reports starting in 2027. And then those federal MCLs are enforceable in 2029. So there's still a lot more ramp up time to install treatment and make changes to bring those contaminant levels down and protect public health.
Got it. And I also wanted to mention that, you know, these do not necessarily, well, they don't cover drinking well water, correct? So if you have a
Correct.
well, what should you be aware of?
So none of these requirements apply to wells. And as Tony was talking about some of the high risk areas in the region, you know, we do have a lot of private wells, even though a lot of our community water does come from the Great Lakes Water Authority system. People often have private wells for landscape watering or other private wells within and around the region. And so the groundwater from that map you showed earlier with all the contamination sites, that groundwater is kind of more likely to have concentrated contamination. So no requirements to sample there, but if you're in one of these areas, you might want to consider doing some targeted PFAS sampling of your well water to see if those contaminants are present at levels of concern.
And if you find contaminants in your drinking water, what do you do then?
Well, then you can consider whether you need a on-site treatment, or perhaps if there's an opportunity to connect to a regulated water system that is meeting the MCLs. Those would be the two strategies.
Got it. And so, Tony, I wanted to check in with you because you as you mentioned, you really interacted with a lot of the science behind this. What do we know about how well these policies are working?
Well, first of all, the starting with the Michigan policy, I think it's working fairly well. It's now been in effect for a couple of years. There have been some places where we've had some problems, but by and large, the public water systems have generally been in compliance. And so, I think two things from that. One, if you're on a public water system, that's a good thing. Because of the continued monitoring, there are some potential for slip-ups in there or time delays that I think folks need to be a little bit aware of. I think also it's really important to note that the fact that this has happened in Michigan, and our limits in Michigan are a bit higher in most cases than the federal limits, but when we're talking parts per trillion, those are very small numbers. And what we're hearing around the country is, oh my goodness, the world's going to come to an end. These standards are going to be impossible to comply with. And I respond to that and I say, look at Michigan. The world hasn't come to an end. There haven't been bankruptcies. Water utilities are moving forward. And people are getting safer drinking water. So I think that those policies are working really well. I think we'll probably talk about a little later on the fish side of it. I have much greater concerns with the guidelines that are in effect right now. But from a drinking water standpoint, I think certainly in Michigan, we've been moving it's in the right direction, and federally, I think as well.
Okay. So we are going to move on to fish, and we do have a question that I'm going to address as we talk about it. But first, I wanted to have Erica Bloom with the Ecology Center tell us a little bit about some of the work that they've done to better understand what the extent of PFAS in fish, recreationally caught fish around our local streams and rivers in Metro Detroit looks like. So Erica, can you share with us a little bit about what that's been like for you and how you participated with communities in doing that?
Yeah, absolutely. So the Ecology Center back in 2021 started a project with the Huron River Watershed Council and Friends of the Rouge. And together, we really wanted to better understand kind of what the levels of PFAS in fish were, kind of more holistically, looking at the entire fish, looking at more than just PFOS, really looking at a range of PFAS chemicals, and really understanding where PFAS kind of accumulating within fish. But we didn't want to just test the fish ourselves. What we really thought was most important in working in this kind of, with science and some of the data that we wanted to collect was to actually work with people who are fishing on the Huron River and the Rouge River. And so in partnership with the watershed councils, we recruited about 6 or 7 anglers to actually help design kind of where the project, where did we want to test for fish? Where is the places that people are most likely to be catching fish? What are the types of fish? And so it was a really great, citizen science project. The Ecology Center does a lot of that. And I think around testing and samplings, especially around PFAS, we need more, citizen science models for people to be really for people who are most impacted and are directly harmed by chemicals like PFAS to be part of, where do you think is the most important things that we should be testing? Soils, water. In this case, it was fish. And where should we be going? So it was a really great project. We did a whole, we took the samples, we worked with labs, and then we have a report out, which I think somewhere the story
the next slide. Yep.
Mm-hmm. Mm-hmm. So we have a report it's on the Ecology Center website. And what we found is that, these are the levels. We worked with Indiana University to help test the actual organs in the fish. And so we found that the highest levels were on average in the liver. We also looked at the intestines and the eggs and the fillet. And this is important because, when the state of Michigan does fish testing, they test for PFOS in the fillets because that's, the most commonly PFAS chemical that shows up and people eat the fillets. But again, we wanted to look at the whole fish because we are, really concerned about, yes, people eating the fish from a public health standpoint and sort of the ecosystem that, mm-hmm. that wildlife, other wildlife eats fish, or how is PFAS, bioaccumulating up a food chain, so there's a lot of other questions that we were trying to answer. So I think that's really why we took a more holistic view. And we know even from studies while we were doing this project and afterwards, that there were fish studies around like Great Lakes, and we know that a lot of the Great Lakes fish have higher levels of PFAS. And so part of the project is really letting people know that, unfortunately, eating fish out of our Great Lakes, especially in parts of the watersheds that have contamination, you're likely to be more exposed. Now, there's mm-hmm. benefits to eating fresh fish too. So mm-hmm. we definitely we want to weigh that in too. But it was a really important project to kind of work with people directly, who were fishing, and also kind of raise some new critical science, kind of explore some new critical science questions.
And I think, one of the things I wanted to point out, which is something that, I learned through the reporting, is that there's really no way to prepare fish in a way that will reduce the PFAS levels. So, for example, we know that there's some kinds of contaminants where if you just melt the fat away or take off the skin, you can avoid some contaminants, but that's not the case here, right?
There's not really evidence to show that. I mean, I think that there's been some research around, what if there's certain types of fish that accumulate less or bigger fish, but I think really what we advise people is to the state of Michigan has an Eat Safe Fish guidance, mm-hmm. and there's some issues. We want to talk about that guidance, but it is good that the state is looking at what could be safe levels, and it's not just PFAS. You look at mercury and other contaminants, and we do tell people that if you're going to fish, you should really be understanding like what your vulnerability is if you're a person with high autoimmune disease or thinking about getting pregnant, you might need to take extra precautions, but really to look at like what number of fish meals per month are recommended for you.
Okay, got it. And Tony, you mentioned having some reservations about our fish contamination and consumption advisories in Michigan. Can you tell us a little bit more about that?
Yeah, and this comes from experience because, as I mentioned, the first "Do Not Eat the Fish" advisory, like the one on the slide here, was issued in Oscoda in 2012, 12 years ago. So the science has changed a lot in 12 years, but the Michigan standard or guidance standard rather, it's not an enforceable one, but the guidance has not changed at all. It sits right now at 300 parts per billion. And I know that there are other states that are, for example, in New Jersey, I believe it's 15, 16, 17 parts per billion. That's much, much lower than it is here in Michigan. And even in states like New Jersey, those levels were set based on the science that existed before this EPA, science came out to support the drinking water standards. So our our guidance standard in Michigan is way too high. And what that means is there are a whole bunch of fish out there that aren't safe to eat that we're not being warned about. We have been pushing, in my community in particular, the state of Michigan to lower its guidance limit since about 2019. We've been told that the state is working on it. We were told that because of the new EPA guidance, that work has been slowed a bit. But my understanding is there's going to be at least a target for a new guidance level in Michigan in 2025. So we're about a year away from that. So it's a little bit of buyer beware. And I think it also is really important for people to understand that if you're fishing in or around a known source of PFAS contamination, you need to exercise extreme caution.
Got it.
So, yeah, so there are definitely concerns there.
And so one of the places where there is this kind of water body wide do not eat the fish advisories now is the Huron River. And we have a question from one of our audience members. It is, she wants to know, how bad is the PFAS contamination in the Huron River, and concerned that people are swimming in it. So, we know there's sections where you can't eat the fish. We know that there's a lot of money being spent, for example, in the city of Ann Arbor to filter the PFAS out of the water for drinking water. But what if you just want to go interact with the river and swim in it? Anybody want to comment on, what to know? And thank you. That's from Ann Pazanski on Facebook. And just want to remind everybody, they can also post some questions.
I can take this one. And yeah, we did we did work a lot in the Huron River, and the fish that had the highest levels were actually in Kent Lake, which is actually upriver from downtown Ann Arbor. It's closer to the source of where the PFAS contamination is. Mm-hmm. But what I would say is, if you're going to swim in Huron River, and it's a great river, I'm in the Ann Arbor area, what you really need to do is avoid the foam that will come up. And if anyone has seen this foam, it's sort of like white shaving cream, kind of like poofs out around dams, but it could also be on the surface and just kind of like slide down the river. And so that likely has PFAS in that foam. And so there should be signs, if there aren't, there should be signs that say do not touch the foam. So if you're around that area, again, you really don't want to touch that. If you're in the river, I would say, wash off. But it's more, I think we want to, I always say we really want to enjoy our river. We don't want to scare people off, but we really need to make this more than just what do I need to do to stay safe? Because you need to stay safe, but we all need to have better systems and regulations that we're getting this stuff out of the water and preventing it in the first place. Because that's, to Tony's point earlier, it's just going to keep happening if we don't, take some real preventative approaches to this.
And following on that, I'd just like to say the advice that Erica just gave for the Huron River really applies to any water body in Michigan. There is a statewide advisory meaning any place in Michigan, if you see this white foam, don't touch it. So it truly is everywhere.
Who's seen the white foam? Raise your hand.
I think we all.
We've all seen the white foam. Okay, yeah. So we're going to move on to sort of like what's next, what's on the horizon with this issue. But I wanted to take a good question from the audience, and that's from Christy Meyer. Oh, wow, look at that. We've got the question on the screen. So PFAS costs a lot in terms of health and cleanup. What do we know about how much it increases water costs and maybe contributes to insecurity in terms of, water affordability? Anyone want to take that?
I don't know if we have any analyses yet about how water rates have changed specifically due to installation of technology to reduce PFAS. But it does cost money. There's generally 3 treatment options that are available for water systems: granular activated carbon, reverse osmosis, and ion exchange. But another favorite in the water industry is to connect to another water system that doesn't have a contaminated source. And Michigan expects up to 33% of the public water systems that might exceed the MCL to just hook up to another system. So, you do that hookup and you're done. So that does a lot to manage the cost of compliance.
Yeah, and if I could come at it from a little different point, because I think Elin covered it very well. What we're seeing in communities like Oscoda, where we have contaminated private wells, which are not covered by the drinking water standards, but still have the same risk associated. One of the options that has been offered in Oscoda, and I think other places around, has been to connect to a municipal water source. And what we're seeing in Oscoda in a number of cases is that people don't want to do that. And it's not because they don't want safe drinking water, it's because they can't afford it. Either they can't afford the hookup fees, they can't afford the monthly water bills. And so, as is often the case, almost always the case, the people at the lowest end of the economic spectrum are hit the hardest by this entire issue.
Got it. So, Elin, are we ever going to get to the place where we can eliminate the risk of PFAS in our drinking water?
Well, as Tony has been saying throughout, we need to, limit the manufacturing of these contaminants. And one thing I don't think any of us have said really explicitly yet is we only have MCLs for 7. There's hundreds of PFAS.
Right. Mm-hmm.
We're only hitting 7 of those, and even when EPA's hazard index comes in, it's not addressing the hundreds of PFAS contaminants. So we're not going to get there until we cut off the supply. And right now, the industries that create these and manufacture with them, that's where the pollution is coming from. We need to have policies that require them to pay for the cleanup, and that's where we get. There's some of these issues with water systems suing EPA. It's disappointing, but it's also really hard for water systems to pay for the treatment when we know that there are companies that have created these contaminants and put them out into the environment. So being more holistic in a kind of source to tap a perspective to make sure that we are cutting them off where they start, and that's the way to get out of this. But there's definitely going to need to be water treatment to meet those MCLs until we cut off the supply that keeps getting out into our water systems.
And probably for some time thereafter, I would imagine, because they're so persistent.
They are forever chemicals.
Yeah, and I just want to follow on Elin's point. I just want to say one of the priorities of our Great Lakes PFAS Action Network legislatively is a bill that's being sponsored by Representative Penelope Cernoglu of East Lansing that would ban intentionally added PFAS chemicals from products in our state. Other states have begun to do that, and it's a really important piece of legislation here in Michigan.
And so would that apply to just goods that would be sold here or manufactured here, or how does that? Can you tell us a little bit more about that?
It would apply, yes. The answer to that is yes, manufactured and sold. And it would be a tiered approach that it would start with 12 product categories that have already been, PFAS have already been banned in those products in other states, including firefighting foam, which we don't have a ban on PFAS in that in Michigan. And then it would go into banning PFAS in products that are considered non-essential, and the state would have a criteria to determine like which PFAS are currently unavoidable in those products. So it's pretty comprehensive, and there are other states that have passed similar legislation. So we're really, Michigan is a leader in some ways in PFAS and identifying, looking at PFAS at the administration level, but legislatively, we really need stronger laws on the books. And so that's one of the things that our PFAS Action Network is working on. And we hope that lawmakers will really take this action, a lot of urgency the rest of the year to do something about this.
Is that moving at all? Has it moved?
It hasn't moved yet. It's been introduced and is in the House Natural Resources Committee. And the PFAS Action Network will be, doing lots of actions this year. So if there's anyone on the call that wants to be, more involved in that and learn more, you can, our contact information is there. And we really want, a broad coalition of people to be pushing for that.
Call your legislator. Call your legislator and tell them we need this bill.
Got it. Any other high priority actions that, you all are working on this year that you want people to know about?
Well, we're also looking at legislation again already introduced in the legislature that we're hoping will move. That would kind of correct a loophole in the Michigan statute of limitations law. It's a very kind of arcane and esoteric thing, but under our laws in Michigan right now, if your property or you are contaminated with PFAS or were many years ago, you had 3 years from when that first happened to file your lawsuit. And unfortunately, most people didn't even know until recently. And so many claims are potentially barred, and we're trying to get that addressed. We're also pushing for medical monitoring, a cause of action to allow people to get medical monitoring if they're in a PFAS contamination zone. And one of the things federally that I know that we've been looking at is trying to provide coverage through Medicare and Medicaid for PFAS blood testing. It's very important that people be able to test their blood and work with their physicians in order to get the health care they need.
Got it. And so we have a slew of questions from the audience, and you can still ask questions just by typing them into the chat wherever you're watching today. We have a question here about, we talked a little bit about low birth weight and premature delivery and that kind of thing. What do we know about, and I know nobody's a physician here, but you've all been working in this space. What do we know about PFAS in terms of how it affects hormones and pregnancies? Anybody want to take that one?
I mean, I'm not a physician, but I've, been learning a lot about this too and talking with people. And we do have, there has been research around the developing fetus and being exposed to PFAS, and that it can move through the placenta, and especially around breast milk too, for, nursing infants, that PFAS can be transferred through breast milk. So it's a real concern for, kind of the first environment, right, of all of us, being in, the womb and having exposure to these chemicals. There has been research that it's have developmental delays or preterm births. So there's a lot more research that needs to be done, but there has been enough. I mean, there's been quite a bit too around knowing that this is something that if you're age of childbearing age or thinking about having children, we really suggest making sure that the quality of your water that you're drinking, that if you can, really looking and seeing it, and if you can test your water supply yourself. And then also just the products and, the environment that you're in indoors too. What are the things that, that you're wearing or your furniture? The indoor environment too is a really important, potential route of exposure.
Got it. Okay. Question about what we're doing to fight these chemicals in Metro Detroit. So we know that there are a lot of these locations where they're kind of hot spots, and there are regulations now. So if you're going to develop a site and there's PFAS found, there's issues that you need to deal with it. What is going on with cleaning up sites across this region, across the state, but mostly this region, and what more do you think ought to be done? Anybody want to take that one?
Well, I think that the first thing that we want to do is to raise awareness of the fact that there are a whole bunch of sites in this area. And in terms of cleanup, it's going to depend on the polluter involved and actions taken by the polluter in conjunction with our State Department, Eagle, in order to address those. I think that it's really important that people in areas that are impacted by that pollution, by that contamination, get involved. One of the things that we've seen really consistently is that when the community engages, when the community expresses the need and impresses upon the regulators that action needs to be taken, the squeaky wheel gets the grease. There are limited resources in our state government. There aren't enough enforcement personnel to go around. And it's really important for people in the communities to raise up their voices and demand action. I know that I'm on the Michigan, the MPART Citizens Advisory Work Group, which is a group of impacted citizens from around the state that advise the state. And there's been a real concern within that group that the Metro Detroit area is not getting the attention that it deserves. And I think part of the reason for that is the awareness in the Metro Detroit area is not as high as it is in other parts of the state. So it's really important for community involvement and community engagement. And Nina, for the public service that you do and others in your profession do to raise this issue in our area.
And so how can people in Metro Detroit find out other than reading Planet Detroit? And we published a map trying to make the state available data through the state a little bit more accessible. Where should people go to find more information and understand if there is a PFAS hotspot in their community and what's being done about it or what should be done about it?
Yeah, go ahead, Erica.
Yeah, well, the state of Michigan has, the Michigan PFAS Action Response Team. Maybe we could put the link up there, MPART.
Yep.
And they actually have a map. It's an interactive map. You can click on it and you could see where they have investigations going on and where they've tested. And each one of those sites, if you click on it, you can go to a website, a separate website on their page that has some information about the site and who's tested in the timeline. And because there's so many sites, what they don't, it's not always updated. So if you really want the most up-to-date information, they have a contact through Eagle that you could just call or email them. And we encourage people to ask questions. Also, you could contact us, the Great Lakes PFAS Action Network. We're available. That's why we exist, is to help people figure out resources and direct them to the right places. And we are happy to connect with those folks.
Got it. We have a question here, and we talked a little bit about this in terms of culpability and companies maybe needing to step up and help pay for some of the mitigation that we're not doing. What kinds of companies or which companies are the most culpable and others regarding PFAS, and what is being done in terms of trying to get some relief in terms of the costs?
Well,
I think that's a Tony question.
Yeah. No, thank you. I think the most important thing that's being done right now in the state of Michigan is that our Attorney General, Dana Nessel, back in, about a year or two after she took office, it would have been 2020, filed lawsuits against the major manufacturers of PFAS chemicals. seeking to to recoup the monies that are being expended by the state on the PFAS matter. Those cases are winding their way through the courts. There has been some private PFAS class action activity that's gone on. There was a big settlement, I believe it was with 3M, for several $billions, which allows community water systems to recoup and gain money from that. I think that that those are really important, because the manufacturers of the PFAS chemicals themselves are probably they're the source, and it's really, really important. Again, as we talked about, to sort of cut it off at the source. Lots of lawsuits kind of winding their way through the course right now. There's actually a national PFAS class action, believe it or not, that's out there and kicking around. So on the legal front, a whole bunch of that. That kind of covers the private side of it. On the public side, you might be surprised to know that the largest PFAS polluter in the United States is the federal government. Through the Department of Defense. There are approximately 700 bases around the country. There are 16 sites in Michigan that we know of so far that the Department of Defense has contaminated. And frankly, the Department of Defense has been extremely difficult to deal with. And we're trying to put pressure on them through our congressional delegation here and through the Biden administration to kind of make some things happen. And it's been a slow process, but we've made a little bit of headway. And again, it's one of those things where we need to interact with our legislators to let them know this is a big deal.
Got it. And we have actually a specific question about one of those bases, Camp Grayling. Do you know anything about what's happening with Camp Grayling in terms of having the National Guard take responsibility?
So what I know about Camp Grayling, that was the second military site in Michigan. Oscoda was the first. Oscoda was the first in the world, the first U.S. military site in the world. Grayling was first discovered in about 2016, 2017. They're about 6 or 7 years behind us. I know that there's been a major push in Grayling to extend municipal water lines. And I know that again, a situation where the local community really got involved and also partnered with the township government there, and then worked with federal officials to try to get water lines extended. I'm hearing there's been some really good progress in that regard. I think also there's a lake up there called Lake Margrethe that has a similar type of kind of a massive foam problem like we do on my lake in Oscoda. And I know that the Lake Margrethe Property Owners Association is really moving forward. But the long and the short of it is they've got a long ways to go, just like we do. And they're making some progress, but I know it's not as fast as they'd like.
Got it. Okay. So we are going to have our last question before we wrap. Jennifer Lee Johnson wants to know what, if anything, is being done about PFAS in the soil. And sounds like she's concerned about places where kids might inhale dust near schools. Is that a major exposure route? And what, if anything, is being done about that?
Well, I know from the Ecology Center point of view, I can speak of, we're working with a community member, an environmental justice activist who's really concerned about PFAS in soil near the Gordie Howe Bridge. And we're actually going to be doing some sampling of soil in that area to get some more results. It is an identified site through Eagle, but from what I can tell, there hasn't been a lot of research and sampling of soils. It's been a lot of, groundwater, drinking water, but I think in terms of dust, I think yes, but we would definitely need to figure out kind of more. I don't think enough research has been done on that. I think indoor, actually, I've heard, indoor air pollution around the PFAS that we just have in our consumer products in our house can actually contribute to, in the dust and get in through. So having, good, filters on our house and just sweeping dust away in our house. So indoor air quality is also something maybe to be concerned about.
Yeah, we didn't mention that at all, but that is something that we mentioned in our reporting. Okay, so I am going to wrap it up and thank all of you for participating today. The Ecology Center and Great Lakes Now are co-sponsors of this webinar, so thank you, all of you. We have a lot of resources in the chat that you can go to, links to find out more information, as well as planetdetroit.org, where we report on these issues regularly. Just a couple of upcoming events. In August, we have a webinar about why clinicians and families should be talking about climate change. And we also have a Poetry and Prose for the Planet call for pitches happening now through July 31st. So I hope that you'll take a look at some of those at planetdetroit.org/events. Anybody have any closing thoughts for us before we let everybody get on with the rest of their day today?
Yeah, I'd like to just, again, thank Dina, you for all of your work and effort on this. I want to thank my friend Elin and point out that if it weren't for Elin and a few others, some notable folks like Dr. Mona and that you heard about, we would never have known about Flint. And Flint is obviously a terrible tragedy, but the other thing about Flint is that it has caused people in Michigan to become much more concerned about their drinking water. And we would not be in a position to talk about PFAS the way we're talking about it today if it hadn't been for that very important work in Flint. And so I just want to raise that up and give her a big thank you and a shout out for everything she's done. And of course, the Ecology Center and Erica, the work on the fish study is really, really important. To everyone in the audience, I want to say this is a very important issue that's going to be with us. It's been described as one of the most seminal public health challenges of the coming decades by a former director of the CDC. You've got to protect yourself. You got to protect your family, particularly your children. And the only way to do that is to stay educated and be on top of things. So thank you all for coming.
Yeah, thank you. Thanks to all of you for the work you do. Anything else you want to add, Erica or Elin, before we jump out?
I just really appreciate the reporting because this hasn't been something that's been as brought to the forefront in the Detroit, Metro Detroit area. And that's a really big part of what we do is we're trying to amplify stories and reporting around the state and really across the Great Lakes region. So we need more people paying attention to what's happening in the Metro Detroit and Detroit regions because there's a lot of, there are PFAS and there's just a lot of other contamination issues that need to be addressed. So thank you.
Got it. Elin, would you like to have the last word?
Sure. Thank you again for having this. And I think this is another opportunity to just pay extra attention to our drinking water quality. Pull out those water quality reports, see what's in there, learn about your water quality, see what is happening in your community, know where your water comes from. So we've got new information as a result of these new regulations. And so take advantage of that, look it up and learn more about what is happening at your home.
And thank you. And we will do our part to help you make that accessible and know where you need to look and help you understand it. So thanks, everybody. Have a wonderful rest of your day. And I hope to see you again soon on our next webinar. Thank you.